If you are looking to understand the anatomy of the urethra, don't scroll. This is a video for you, because in this video I'll be giving you in details the gross anatomy of the urethra. Because we did the urethra, the bladder. Now we are doing the urethra. So if you have not watched my video, go back, watch all the videos, so you understand the trend, how we begin from the kidney down to the urethra, to the bladder and the urethra now. So go and watch it. And if you are new to my channel, make sure to subscribe and turn on your post notification button, so that anytime I drop any video, you'll be sure to be notified. I remain your great science tutor, Lorenzo, and if you want me to make a video for you, write it down in the comment section. I'll personally make the video for you. Now let us jump into the video and explain in details the anatomy of the urethra. So anatomically, what is the urethra? Very easy. The urethra is just like a fibromuscular tubular passage that transports urine from the bladder to the exterior. So don't forget, it transports urine from the bladder to the exterior during what? Urination. For male and female, it transports what? Urine. But for male specifically, it also transports semen during what? Ejaculation. But with research too, it has seen that women, female, also the women also transport what was the content of the urethral gland, because they have some urethral glands synonymous to the prostate, which is the Schill gland, which we'll talk about later. So since we have understood what the urethra is now where is it beginning from? What is the extent? What is the extent of the urethra? The urethra is extending from what? The internal urethral orifice. The internal urethral orifice, which is covered by a sphincter in the neck of the bladder. The internal urethral orifice, which is present at the neck of the bladder, to the external urethric orifice present at the glans or penis. Present at the glans or penis. From the internal urethral orifice present in the neck to the external urethral orifice present in the what? In the glans penis. While for female, it begins from the internal urethric orifice, then it journeys throughout, pierces the urogenital diaphragm. So it's same way from the internal urethric orifice in the neck of the bladder, same thing with that of male. But this one now, it continues, pierces the perineal membrane in the urogenital diaphragm, and then what does it happen? Now it continues in the what? Anteriorly in the vaginal wall, the anterior aspect of the vaginal wall, and opens above the vaginal orifice. So it continues in the anterior wall of the vaginal wall after it pierces the perineal membrane located in the urogenital diaphragm. Then it opens above the vaginal wall orifice, 2.5 centimeters away from the clitoris. Don't forget. For male, it opens in the glans penis, while for female, it opens above the vaginal orifice, 2.5 centimeters away from the clitoris. Now for the length of the urethra, now one thing you have to know, now the length of the urethra in male varies between 18 to 20 centimeters long, while for female it is just 3.8 to 4 centimeters long. Don't forget. The size and the shape of the urethra differs during erection and flaccidity. For the female, it is just straight. So when it is flaccid, it gives a J shape, but when it's erect, it gives a what? An S shape. Don't forget it. So we have discussed the introduction, we discussed the extent or the course, and we discussed the length, and now we have discussed the shape. But for female, it doesn't have any word shape. It's just a long continuous tube. Now the next part is for male. Now we have what we call part of the word urethra. So what are the part of the urethra? So the part of the urethra, they have 3 parts of the urethra, but in some textbook you have 4 parts of the urethra. So I mentioned the 4 parts and everything, and I mentioned the 3 parts, so in case you are using your materials or other materials or textbooks, you could appreciate it very well. Now you have 4 parts. We have the pre-prostatic part of the urethra. Now you have the prostatic part of the urethra. Now you have the membranous part of the urethra, and you have the spongy part of the urethra. Don't forget the pre-prostatic, the prostatic, the membranous, and you have the spongy part of the urethra. Now in some textbook we just go to prostatic part, membranous part, and the spongy part. Now one thing you have to know, now the pre-prostatic part, why it is there, it's beginning from the uvular vesicae, which is an elevation present in the internal urethral sphincter at the neck, up to the upper part of the urethral crest, or the upper part of the seminal colliculus. It's about 0.5 to about 1 centimeter long. We call it the pre-prostatic part because it is above the prostatic part, above the prostate gland. It's just close to the bladder. Don't forget, that's why they call it the pre-prostatic part. Why the prostatic part is about 2 centimeter long, 2 to 3 centimeter long, and in this part here, it is covered by the prostate. It is covered by the word prostate. It begins as a medial longitudinal elevation called the urethral crest. The urethral crest is just a tiny pointed elevation, and now at the middle part of the prostatic urethra, it forms what we call a widened elevation, much more bigger than the urethral crest, called the seminal colliculus. So the pointy part of the urethral crest continues, but when you get to the middle, it widens up and becomes bigger, called the seminal colliculus, and then it descends down and becomes also the urethral crest again. So the urethral crest, the seminal colliculus, and the urethral crest again. So you appreciate it in the diagram that is showing on the screen. Now, in that seminal colliculus, what happens? You have 3 openings in the seminal colliculus. In the middle, you have the opening of the prostatic utricle, while by the side of the prostatic utricle, you have what we call the opening of the ejaculatory duct. This opening of the ejaculatory duct is where the common ejaculatory tube that continues from the seminal duct opens into the prostate, into the prostatic urethra. So now the vas deferens joins the seminal duct and becomes the common ejaculatory duct, which opens in the prostate at the prostatic urethra, which releases what we call semen or seminal fluid into the prostatic urethra of the urethra. Don't forget. So now the semen enters into the urethra through this common ejaculatory duct, opening in the opening of the common ejaculatory duct. So don't forget, you have the common ejaculatory opening at either side of the prostatic utricle, and the common ejaculatory opening is the opening of the common ejaculatory duct, which was formed by the vas deferens and the seminal tube. Don't forget. Now, by this side of the seminal colliculus, you have 15 to 20 openings called the prostatic sinus. We call it the prostatic sinus, where the prostatic glands also releases some secretion into the prostatic urethra. So don't forget, you have the urethral crest. In the middle, you have the seminal colliculus. In the downward part, you have the urethral crest. In the seminal colliculus, you have 3 openings. The 2 sides opening as the opening of the ejaculatory duct, while in the center is the opening of the prostatic utricle. While by the side of the seminal colliculus, you have 15 to 20 prostatic sinus, which releases mucus secretion, which lines and coats the prostatic urethra. Don't forget that. You should also know that this prostatic urethra is the most widest and most dilated part of the urethra. So it is very big because it contains the seminal colliculus, the urethral crest with the ducts and opening there. So it's the most dilated part of the urethra. So now the next one is the membranous part of the urethra. The membranous part of the urethra is the least dilated and the narrowest part of the urethra. It's just 2 centimeters long, and it transverses the urogenital diaphragm. And also it now pierces the perineal membrane. It contains what we call voluntary fibers, which is skeletal muscle fibers, which allows you to control your urination. So like I said, it's innervated by the pudendal nerve, contains skeletal fibers. Again, it's innervated by the pudendal nerve, contains skeletal fibers, which is present in the urogenital diaphragm. And at this particular point, it also pierces the perineal membrane. It contains pudendal fibers, which makes you control urination willingly. In the spongy part of the urethra what happens? It's about 15 centimeters long, and it transverses what we call the corpus spongiosum of the penis. It transverses the corpus spongiosum of the penis, because the penis is covered outside by the skin. After the skin, you later see the corpus cavernosum. From the corpus cavernosum, you see the corpus spongiosum. Then you now see the urethra transversing through the corpus spongiosum. That's why it's called the spongy part of the urethra, about 15 centimeters long. Now, one thing you have to know that it begins from the bulb of the penis, which is a continuation from the membranous part of the urethra after it pierces the what, the perineal membrane, and it continues. First of all, it goes what, upwards and forward. It goes upward and forwards. Then later it now goes downwards and forward continuously. Then when it goes downward and forward, it now pierces and transverses through the corpus spongium, then opens in the external urethral what, meatus or orifices, which is very small. It is very, very small, close to about 1 to 3 millimeter or 6 millimeter in diameter. Let's just say 6 millimeter in what, in diameter. Then it is very small, and that is the most narrowest split apart from the membranous urethra. That the opening of the urethra is very small, the most narrowest split, which is about 6 millimeter in diameter. Then now when it opens there, now what happens now at this part? The bulb of the penis has 2 dilations. It has 2 dilations. The first dilation is at the bulb, where we have what's called the bulbar dilation, or we call it the interbulbar dilation. While the next one, which is about 3 centimeter in diameter, and you have the what, navicular dilation, or they call it the navicular fossa, which is about 1.25 centimeter in diameter. So don't forget, it has 2 dilations. You have the what, the bulbar fossa or the interbulbar dilation, which is 3 centimeter in diameter, and you have the what, the navicular dilation or the navicular fossa, which is 1.25 centimeter in diameter. So just know that you have 2 diameter. Now at this particular point, also the bulbar urethra gland, which originates from the membranous urethra, also opens in this bulb of the urethra. It opens in this bulb side of the penis. So just know that the bulbar urethra, which is the carpal gland, also opens inside the bulb of the urethra at this particular point. So when it opens here at this fossa, it opens in this fossa here. Then continuously, also we have another one in the navicular fossa too. Also, you also have some small glands located in that area too. So now in the urethra, in the throughout the length of the urethra, you have little urethral gland called the lateral glands that opens and secretes mucus to line the urethra and prevent the forceful action of urine during urination. Because during the forceful action of urine, it can damage the mucosal wall. So that's why the presence of mucus secretion also helps to coat the mucosal wall. In female, also you also have urethral gland that is scattered all over the wall of the urethra doing the same thing. Also, you also have some pits, some recesses too, where this urethral gland opening, where this urethra, we call them the lacuna. They call them the what, lacuna. But in male, there is a presence of the a lacuna present in the superior wall of the urethra called the what, lacuna what, magna. Called the lacuna magna. The lacuna is where the urethra opens, the urethral glands opening to pour out the secretion to the what, to the lumen of the urethra. Don't forget, the lacuna what, magna is the name of the pit or recess where the urethral gland opening. I get it now. Why the small urethral gland located in the urethra is called the lateral gland or the urethral what, gland. Also in female, you have the paraurethral gland of scale. The paraurethral gland of scale, which is the largest urethral gland located in female, which is homologous to the prostate gland, which I tell you that during urination, sometimes, especially during arousal or during sexual activity, some part of those urethral gland of scale, the paraurethral gland of scale, is usually secreted also in accomplishing urination, during urination. That's why we call it the female word, the female word ejaculate. So sometimes in research I saw that the female usually ejaculate usually using what, urination, not only male. So the male own occurs when the male own occurs, the bladder is closed. But when the female occurs, female own can occur in accomplishing the urination process also. So don't forget it. So we have talked about the spongy urethra being 15 centimeter long, it transverse to the corpus spongium, and it has some little gland called the lateral gland opening in the what, in the lacuna or recess, especially in the superior wall, called the lacuna magna. So you have 2 fossa. You have the interbulbar fossa, which is 3 centimeter in diameter, and you have the navicular fossa, which is what, 1.25 centimeter in diameter. So now we have talked about all the parts. We have talked about the pre-prostatic part, which is above the seminal colliculus. We have talked about the prostatic part, which is below the seminal colliculus, down to the urogenital diaphragm, where the membranous urethra transverse piercing the what perineal membrane, 2 centimeter long. Then it continues as a continuation of the what of the spongy part of the urethra, which is 15 centimeter long also. Don't forget it. So one thing you have to know, that the widest and most dilated place is the prostatic urethra, while the most narrowest or the least dilated is the what is the membranous urethra. While the most narrowest place in the urethra is the opening of the urethra at the what at the glans penis. Now, what is the epithelium? What is the lining of the urethra? The lining of the urethra is not one lining, it's not one mucosal lining, it has all two. Now, above the superior colliculus, from the what uvular vesicae, or which is the neck of the bladder, down to the above the superior colliculus, it is lined by the transitional epithelium. Just same thing with the bladder. Below the seminal colliculus, down to the membranous urethra, it is lined by what the striated what columnar epithelium. The membranous part of the urethra is lined by the same thing, striated columnar epithelium. Only you see the transitional epithelium above the superior colliculus, while the prostatic and the membranous is what is lined by the word striated columnar epithelium. Same with the spongy part. So the prostatic part, the membranous part, and the spongy part are all lined by stratified columnar epithelium. Why? Because they have presence of glands are secreted here, especially the columnar glands. While above the superior colliculus is transitional epithelium, while in the opening, which is the external urethral orifice, is lined by what? By simple stratified squamous what? Epithelium. Don't forget it. Also, like I also said, don't forget you have the internal and the external what? Sphincter. The internal sphincter is supplied by the sympathetic nervous system, which is usually closed during what? Bladder filling, and open during what? Bladder emptying. While the external urethral sphincter is located in the membranous urethra, which is supplied by pudendal nerve, which is released voluntarily. Don't forget it. Now, one thing you have to know for female, now the female urethra is very short, which is 4 centimeter. That is why it is prone to what we call infection, urinary tract infection, UTIs, due to the shortness. So bacteria can travel to the urethra and infect the bladder at some point. Also, female is prone towards urinary incontinence due to the fact that their urinary tract is very short, and also during childbirth there can be laxity of the urogenital diaphragm. Don't forget. Why in male there's what we call urethral rupture. The urethra can rupture, but usually it's at the bulb of the penis for male, at the bulb of the penis. But the urethra can rupture in two different places. It can rupture above the urogenital diaphragm and below the urogenital diaphragm. And how can you rupture the urethra? Is maybe you can have a direct sharp object piercing that part of the urethra, or accidents or a trauma that allows the urethra crushing on the pelvic bone, because the pelvic symphysis is located there, and the body of the pelvis is also located around that area. So during a trauma or a direct trauma to that area through a sharp object or a striking force to that area, what happens? You can have what we call the urethra can rupture. And once you rupture, there was what we call extravasation of urine. There will be extravasation of urine, whereby as the bladder is secreting urine, what happens as the urine is flowing down, it will start entering the pouches. It will start entering the pouches. If it is above the urogenital diaphragm, it will enter what we call the deep perineal pouch. Then there will be backflow of urine. There will be backflow of the urine to the bladder and to the extraperitoneal space. Don't forget. But if it's below the urogenital diaphragm, what you have what we call the superior extravasation, where it will start entering the superior or the superficial perineal pouch. From there, it will go over the scrotum down to the scrotum, down to the penis, and down to the body of the anterior abdominal wall. Sometimes it can enter peritoneally too. So now I have known about the rupture of the urethra causing superficial extravasation and deep extravasation. So depending on where the crush injury is. The next one, you can have what we call catheterization of the urethra. So anytime there's maybe a block, or we want to enter the bladder from the urethra, or yes, maybe there's a block of the urethra at any particular point, and we want to relieve that blockage, we use a catheter. We use a catheter. So a catheter is doing what is plunged into the urethra from the opening. But always take on the anatomy of the urethra. No, we tell you that when the urethra is erect, what happens is it's an S shape. When it's flat, it's a J shape. So during catheterization, everyone, the clinician is supposed to know the anatomy and the direction of the urethra, because it's not straight. So that to prevent crushing injury or perforation of the urethra, which can cause a extravasation. Because when you are putting it through the external ureteric orifice, there's always a recess and a urethra fold guarding the urethra at that opening to prevent anything from entering through. So when you want to plug in the catheter, what you have to take note on that fold and the direction of the urethra. Don't forget, to prevent injury to the urethra. The last one is hypospides. Don't forget, hypospides, or you can call it hypospidesis. What is hypospidesis? Is when there's abnormal urethral folding during in utero, because naturally the urethra folds, and when it folds, it only opens in the tip. At first, all the part of the urethra, especially in the downward part, in the inferior part of the urethra, is open in utero, in when the fetus is in the womb. But now they begin to close, the urethra begin to close. So when it closes finish, it only opens in the glans penis, in the tip of the glans penis. But hypospidesis is when the urethra is not closed, it is open in either part of the inferior part of the penis. So now if it is not open in the tip, it is open in the downward part of the glans penis, in the downward part of the glans penis, just a few centimeters down of the tip. We call it the glandular opening. We call it the glandular opening, or the glandular hypospidesis. If it is open in the base of the glans penis, you call it the balanic hypospidesis. The balanic hypospidesis. If it is open in the middle of the penis, in the opening in the middle of the penis, you call it the penile hypospidesis, or the penile opening. If it is open in the pineoskeletal junction, in the pineoskeletal junction, you call it pineoskeletal hypospidesis. While the last one, we have the perineal hypospidesis, when it is opening in the scrotum. Don't forget. So now we have talked about everything about the urethra. We have talked about everything. So the blood supply to the urethra is still the same, the blood supply to the penis. So the penile artery and the perineal artery draining in the penile venous plexus and the perineal venous plexus too, the same thing. Don't forget it. So now we hope you have understood everything we have talked about the urethra, from the length of the urethra, from the course of the urethra in male and female, down to the clinical correlation of the urethra. I hope it all made sense to you. So when you are studying it and you are watching the video, make sure to use your atlas to read. It's very, very important, because you can appreciate it more when you use your atlas. And if the video is too fast, make sure you can also YouTube or auto subtitle to watch throughout the course of the video, or to slow the video so that you can appreciate what we are saying. But the reason we are making it like this, so that the videos will not be too long. Also, like I said, if you want me to make any video for you, make sure to drop it down in the comment section. And also please subscribe to my YouTube video. Subscribe to our video and put a like on that. Put a like button on it. Always put a like button on it. And also, if you are new, please always watch the video to the end. It is very, very important. So if you have stayed to the end of this video, thank you for always staying to the end of my video. If you stay to this end, God bless you. And also, I'll see you in the next video. Bye bye.